Usually, we understand viral fever as a cold, cough, cold, sore throat. But viruses can also be deadly. Sometimes they attack important organs of the body, as is the case with viral meningitis. The thin covering that surrounds our brain is called the meninges. If the meninges become inflamed for some reason, it is called meningitis. It is usually more common due to infection. In addition to viruses, this infection can be caused by bacteria and tuberculosis germs. The germs that infect vary depending on age and environment. If an infection occurs in the nose, ears, throat, or any part of the head or any organ near the brain, it can spread inside the skull and cause meningitis. If an accident occurs and the flow of germs to the brain becomes unhindered, meningitis can occur. Infection from any part of the body can spread to the blood, causing meningitis as a severe complication. The main symptoms of meningitis are fever and headache, stiff neck, red spots, rash on the body, feeling restless, loss of consciousness, etc. However, the same symptoms of meningitis do not appear in all cases in the same way. Meningitis is a serious disease. Since the covering that protects the brain is damaged, the normal functioning of the brain is reduced. However, if it is caused by a virus, it will eventually heal on its own after a severe headache and fever. Meningitis caused by bacteria and tuberculosis can cause serious complications and can even be fatal. Although viral meningitis does not usually cause serious problems, if the brain becomes inflamed, it can be fatal. Bacterial infection can damage the normal flow of the fluid, CSF, that surrounds the brain. Blood flow to the brain can be obstructed and the brain can swell. As a result, the patient's consciousness changes, various neurological weaknesses appear, and the patient can go into a coma. Meningitis, which is caused by tuberculosis bacteria, usually causes long-term illness. To prevent meningitis, it is important to prevent any infection, especially infections of the nose, ears, throat, and mouth. Hygiene should be followed. If you get a head injury, you should get appropriate treatment to prevent infection. Remember that just having a headache is not meningitis. However, if you have a high fever, headache, and stiff neck, you should immediately consult a neurologist.